Hi, I am Dr. Aman. I am a practicing aesthetic physician. I am practicing holistic medicine. We will talk about a very common problem, especially in youngsters and many a times in slightly older people also. Especially these days we see this problem happening even in middle-aged women and middle-aged men. This is the problem of pimples or acne. We see a lot of patients coming out with small pimples all over the face. Sometimes pimples happen more in the jawline area or more on the neck. Sometimes pimples happen even on the scalp or on the V of the neck. Many a times pimples happen, especially if they happen at a younger age, they are predominantly physiological. There are some amount of pimples occurring on the cheek. This area is more or less normal. Having a few pimple eruptions a few times a month is considered to some extent normal, but yes, we need to treat that. Simple applications, a few dietary precautions usually help in taking care of the pimples and preventing recurrences. Sometimes some types of pimples tend to be very big. We tend to get big cystic acne on the side of the face or the whole face. We get big boil kind of pimples on the face. Now that needs urgent attention and they can cause big time scarring. It is not only important to treat pimples externally, but also look at what are the underlying causes of pimples. The acne that happens on the jawline or on the side of the face is usually hormonal acne. We should listen to our treating physician and find out the underlying hormonal problems and treat it accordingly. There is a type of acne which a lot of younger men get, especially only on the forehead acne. That happens sometimes because of the habit of smoking. Smoking causes acne frontalis, frontal acne. So treatment is slightly different. Cessation of smoking helps. There are many ways and methods of treating acne. Step 1, we should first focus on what we are eating. Anything that causes inflammation, very spicy, very sugary foods, too much of carbohydrates, too much of breads and biscuits, too much of tea, coffee will all may have the potential to aggravate acne. We have to rule out underlying hormonal causes. We should also rule out if there are certain medicines which our patient is taking which can cause acne. Barring this, the standard line of treatment for acne is first step is infection and reaction control, then we focus on recurrence management, then we also focus on cosmetic treatments. With just a few applications over a period of 3 to 6 months, we should be able to achieve good cosmetic improvement. Sometimes in some cases lasers may be required also, but in the concept of holistic medicine we should look at the internal causes of acne. We don't only treat outside, we try and manage it inside out. If there are any underlying causes of acne inside the body, we should treat those. Hormonal changes is one very important and commonly missed factor. As far as management of acne is concerned, especially the first step, infection part, it is very commonly seen that patients abuse antibiotics. Doctors prescribe antibiotics and patients keep using the antibiotics on their own, or some patients get hooked onto or get used to taking or applying only steroids. It is a very harmful practice, must be avoided. As far as our practice is concerned, we try and manage acne with as low dose and as less duration of antibiotics as possible. Many a times oral antibiotics are totally avoided. We have to take very good protection against the germs getting resistant. Along with all the treatments, there are other certain simple herbal or home remedies that can be added to the treatment, which goes a long way in managing it. To know more about our concept of treatment, you can look up for me on Lybrate or read up all the unbiased information on holisticsskincare.in.